The director of the Karapitiya Teaching Hospital in Galle, Dr. Jayampati Sinanayaka, said that the viral flu had claimed the lives of 5 children over the past month. With much conjecture hovering over the outbreak of flu in the southern province, medical officials of the Karapitiya branch of the Government Medical Officers Association convened a media briefing on the current health crisis.
A fever epidemic is going on, particularly in Galle and Matra district of the southern province, and the consultant opinion is that this is influenza viral infection. Mainly the small children who are less than 2 years are affected. Some of them have already died due to secondary infections after the primary influenza infection. Authorities have not yet so far taken adequate measures to educate the general public about prevention of this disease. There is a vaccine. At the moment is available only in the private sector and it costs around 1,500 rupees. We think that giving the vaccination is more cost effective than treating the critically ill patients. Elderly people who are over 65 years and other people whose immunity is low, and the healthcare workers should be vaccinated.
Members of the GMOA also expressed views on the inability to admit patients with influenza to the ICU of the Karapitiya Teaching Hospital, as the ICU is at maximum capacity.
The ICU facilities for the critically ill children in Karapitiya Hospital is not adequate. The ICU facilities should be expanded.
Meanwhile, the director of the Karapitiya Teaching Hospital in Galle emphasizes acting immediately while recognizing the symptoms of the influenza virus can help minimize its spread.
If your child has fever, cough or breathing problems, do refer to a doctor and admit the child to a hospital only if necessary. Because if you admit your child unnecessarily, there is a risk of the flu being spread.